Hello everyone, it's Sophie here. I am the hygienist and therapist at North Street Dental and Implant Clinic in Dudley, and I've been creating some videos during this isolation period to help you with your self-care of your oral health at home. Currently we're not providing routine treatments, so hopefully these videos will give you some tips and advice for keeping your mouth clean and healthy at home. Today's video is all about denture care, and this is the advice that we give to our patients here at the clinic, but it is relevant to anybody who wears a denture, whether it's a partial denture or a full denture. This advice is for you. If you have natural teeth, then please refer to my previous video on tips for keeping natural teeth healthy, because this video is just specifically for dentures. So I have got a denture model here. This denture doesn't belong to anybody else. It is just a demonstration model before anybody wonders who this belongs to. So I've got 3 steps for you for keeping your dentures nice and clean. Dentures should be kept as clean as natural teeth. They can still get stain on them, they can still get deposit on them, and not only does that make the denture look dirty, but if it's rough, the deposit can cause the areas that it's touching to become sore because it can rub, and it can make the denture feel not as fresh in the mouth as well. So these steps will help you keep the denture nice and clean, but also help your mouth feel nice and clean whilst you're wearing your denture too. So the first tip is to be using warm soapy water when you're brushing your denture. The reason why we say warm water is because hot water can blanch the denture, so it can mean that this pink colour of the gum will become lighter in colour. And the reason we say to use soap and not a toothpaste is because toothpaste is damaging to dentures. It's abrasive, so it will scratch the acrylic of the denture. It doesn't cause any harm on enamel of teeth, but it does scratch acrylic. So warm soapy water is all you need. We normally recommend something like a dish soap, like Fairy Liquid, or even a hand soap. People will often say, well, what about the flavour? You're rinsing it off, so you're not going to taste it. So using something like this, like a denture brush, this is specifically designed for dentures because it means that you can give it a really good scrub. So you're going to use your soapy water and give it a really good scrub on each individual tooth, working your way around on the inside as well, giving the palate a clean, which is this bit, and the other side as well, giving it a really good scrub over. These brushes are really useful because this smaller end, you can get into these areas here, and also if you have a lower denture like this one, and this one is implant retained, it means that it's attached to implants in the mouth, but this shape really gets nice and into those grooves and gives it a really good scrub. And we'd say to do that twice a day, morning and night time. The second tip is to be using a denture soak using a cleansing tablet. Sterident is a popular choice, but there's lots of different cleansing tablets out there, and we would say just to go with the manufacturer's guidelines on the tablet that you have. Some of the tablets are overnight use, some of them are just for 2 minutes, so just make sure that you read the guidelines for the manufacturer's advice for your specific tablet, but we would say to do that daily. And that's because those tablets are designed to cleanse the denture, so they get rid of any bacteria, and that bacteria can affect the mouth. So keeping them clean in that way will just help everything keep clean and fresh, both on the denture and inside the mouth as well. And the third step that I have for denture cleaning is to keep the denture out overnight. The reason why we say that is because the denture puts a lot of pressure on the tissues, which is fine for kind of every day, but overnight it should be kept out so that the tissues can be allowed to settle. The denture, when it's left in the mouth, because the mouth is not only damp, it is dark and it is warm, which encourages bacteria build-up, specifically fungal bacteria, which can lead to things like denture stomatitis. So we recommend that the denture is kept out overnight, that it's kept clean, and that way not only is your mouth nice and healthy, but the denture stays nice and clean too. So those are my 3 steps. So number 1 is brushing with soapy water, warm soapy water, not hot. The second is to use a cleansing tablet, and the third is to keep the denture out overnight. If you follow those steps, your mouth should stay healthy and your denture should stay clean and fresh too. We do offer a denture polishing service at our clinic. It's known as a Simpro Clean, so if you are a patient of ours and you're missing your cleans, they will be back soon once we're running our routine appointments again. If you've never had your denture cleaned professionally before, then I would recommend it. Our technicians polish the denture and they also soak it in the Simpro machine, which gets rid of any stain and leaves the denture coming out good as new. So if you don't have that already booked, then we'd recommend that you get that in when our clinic reopens for routine appointments. Until then, please stay safe, stay healthy, look after your loved ones, and we'll follow the government guidelines, and we'll see you soon.